So today is the day of my open heart surgery where I'm having my two birth defects fixed in my heart. I have a atrial septic defect at the bottom of my heart. There, the bottom chambers where there's a little hole between the two chambers. And then the other thing I have is called a bicuspid aortic valve. So the valve coming off the aortic root has 2 flaps instead of 3. And over time what's happened is those flaps have had to work really hard, and the blood is swirled back and created scar tissue on the valve, and it doesn't open or close very well. So consequently, the blood flows back into the heart, the part of the heart that just tried to pump out of, and the blood does not circulate through my body. So those of you who always complain that I was always cold, there was a reason. I didn't know I had this birth defect until my kids were about 2. They're 13 now. And so, yeah, it's like the big surprise. So I was able to do everything, and I'm doing what I can do now. So for me, you know, I just think of what's gotten me through things that I didn't think I could do. And it's just trying to be strong and being a little crazy. So that's kind of how I'm approaching this. It's like this whole thing is so far beyond me. If I think about it too much, it's really overwhelming. But if I just concentrate on what I know I can do, I know I can be strong, and I know that you just got to be slightly nuts to just jump into this. Just like I've jumped into a lot of things where I've had some big accomplishments, like a twin pregnancy, being able to become a strong first level 2 instructor. I was able to do all those things because you just don't, I knew about it, but I didn't really let it slow me down or affect me. I modified, and then when it became an issue, I modified even more. So just having the strong, don't give up attitude, you just do what you can do, and you take breaks. You just do everything you do very cleanly and smartly, and that's what I'm just holding on to right now. So I just want to have a nice workout before I go down to UCLA today. And just, this is who I am, and this is what I'm going to carry mentally into my procedure and recovery. Okay, so I just did some goblet squats and some swing clean presses. Okay, just to get warmed up. So this. Really opening up my chest and hips to hold on to that mobility and stability for myself. And I do have to take a lot of breaks because I get breathless, and talking is making it a little more exacerbated. So, okay, the other thing I do is swing to a clean press. Switch, just one on each side. So I've had to modify the breathing and the hip snap, obviously, and I'm using a lighter bell. So not as aggressive hip snap with a lighter bell for me. Plus it just kind of helps me breathe better. All right, then the other thing I like to do is my Turkish get up, which I absolutely love. Okay, so that's about it for today. See you soon. Bye. Wish me luck.